A terminal diagnosis strips away every illusion of control. In an instant, families are plunged into medical uncertainty, entirely dependent on local government safety nets to provide dignity and support in their final days. On paper, the London Borough of Hounslow appears to be a model of efficiency. The Care Quality Commission recently evaluated the council's adult social care provision and officially rated it as good. Official policy updates from the Northwest London Integrated Care System reinforce this narrative. Their 2026 roadmap boasts an ambitious expansion of community specialist palliative care teams running from 8 a.m. to 8 p.m. 7 days a week, alongside brand new 24-hour hospice at home services. But public relations documents do not treat patients. Recent press investigations reveal a local system buckling under its own weight, leaving vulnerable residents stranded when they need help the most. The local government and social care ombudsman recently issued a stark warning about this exact dynamic, describing a deepening crisis of public confidence, where residents are simply not receiving the care they expect from their local authorities. Passing grades and strategic roadmaps often act as a bureaucratic mirage. They project competence to regulators while masking a catastrophic breakdown in care for the people who actually rely on the system to survive. To understand how a council with a good rating fails its residents, we have to look past the top-line score and examine the buried data, specifically how the borough treats unpaid carers. According to CQC findings, family members providing round-the-clock palliative care in Hounslow wait up to 93 days for an initial assessment. This chart visualizes the cost. Only 27% receive adequate support. The vast majority are left completely isolated. When a patient needs to be moved into residential care, the bureaucratic logjam worsens. Hounslow outsourced its financial assessments, causing severe delays that leave families trapped in administrative limbo, unable to make fully informed financial decisions prior to moving a dying relative. A high-level passing grade easily absorbs these localized failures. The council keeps its reputation, while unpaid families bear the crushing physical and emotional brunt of daily care. When families try to challenge these failures, they face the 2025 Adult Social Care Statutory Complaints process. The council's own document outlines a demanding procedure requiring 20 working days just for a Stage 1 resolution. The policy is also filled with jurisdictional loopholes. If a family takes a direct payment from the council or scrapes together their own funds to arrange private care because the public option failed, the local authority washes its hands of responsibility. For families caught in this maze, the local government and social care ombudsman is often the only remaining avenue for justice. Recent data from the ombudsman reveals a sharp rise in institutional negligence. Out of 31 investigated complaints against Hounslow Council in the 2025 to 2026 period, 26 were upheld. In one specific case, the council unlawfully billed a vulnerable man for post-hospital care that the NHS was legally required to cover. In a neighboring London borough reviewed by the same watchdog, a disabled pregnant woman and her child were left languishing in illegal, unsuitable bed and breakfast accommodation for over a year. This system functions as an administrative shield. By requiring endless forms and months of waiting from people who are running out of time, the council effectively deflects institutional accountability. While patients wait on lists for minor adaptations to maintain their independence, often passing away or deteriorating so rapidly they no longer need the support by the time they are finally assessed, the local government has very different financial priorities. Hounslow politicians are currently considering a massive £75,000 allowance package for the council leader. It is a stark contrast to the 93 days families spend waiting for basic social care assessments. The Ombudsman has explicitly stated that society has a once-in-a-generation chance to fix these broken public services. True systemic rot takes hold when a local authority prioritizes its own financial comfort and public image over the dignity and survival of its terminally ill citizens. Accountability starts with the facts. To read the full investigation and get live updates on this story, visit thelondoner.news.